Hello again, my name is Josh Jacob, consultant orthopedic surgeon. This is my colleague Ashwinathan. Now, if you've listened to the spiel about a total knee replacement and the run-up to the total knee replacement, we're going to have a few minutes devoted to what happens after the knee replacement. You've come back to the ward, you're tucking into your evening dinner, your consultant comes and sees you and tells you all went well. But is that all just the way it's going to be, or is there more to be expected? A total knee replacement engages you as much as it does us. The first 6 hours or so, you're not that painful because the anesthetic is working. Your knee feels like a frozen leg, and you feel pretty much detached from your body. After 6 hours, the pain kicks in. What happens then?
So yes, so we come and see you when you don't have any pain, and that makes us look very good. But when the pain kicks in, it is initially difficult to manage the pain, and it's preempting that is very important. So there are various ways that the pain can be controlled. Now I do that, I'm sure Mr. Jacob does that. We give a lot of local injection around the knee, which helps the pain to only gradually come back, and we have a special technique of how we do that, which helps to decrease the amount of pain you get. Second is that we give medications before you go to surgery, hence it helps your body to acclimatize with the pain which you are getting. And third, we also give breakaway pain relief with morphine. We rarely give PCA pumps. Do you give PCA?
No, I don't. PCA means patient control analgesia, which you can actually titrate the amount of fluid and painkillers. I don't generally tend to do that because it feels nauseous.
Yes. So it's a fine balance, because what you don't want is have lots of morphine, feel constipated, not able to sleep in the daytime, feel sick, and not being able to mobilize. As they say, no pain, no gain. So you will be in a little bit of pain, but it could be well controlled by a graduated medication program, which we both follow.
Yeah. Remember, also get some frozen peas from your local corner shop or supermarket. Absolutely essential. The ice helps to cool the things down, keep the knee on a cool and quiet, and also minimizes the swelling. Swelling contributes to pain also. We want to keep the swelling down. It's imperative that you actually start walking as soon as possible. Once your legs feel less wobbly, once your blood pressure is stabilized, once you feel less nauseous, make sure you can walk. By 6 weeks, you should be walking at least to your nearest corner shop, or at least a mile, so that the walking enables fluid to be dispersed from the knee, minimizes the swelling, and you're on to a quick path of recovery.
Yeah, 6 weeks, shall we say 2 weeks, if they can, well, as soon as they can start walking.
Yes. Yeah.
And I think it's quite vital what Mr. Jacob said. You should be able to go home as soon as possible, because the best physio is at home. Because you have to get up and make yourself a cup of tea, unless you have Mr. Jacob's butler who makes a cup of tea for him in the morning. That's Mr. Jacob.
Now, on a slightly different note, I also encourage people to go as soon as possible home, because the germs at home are best known to you. The germs in the hospital are new and they like to attack you.
That's a good way of saying that.
They're friendly germs, so you want to get back to your own familiar environment so that you minimize the risk of infection. What about clots on the leg and lung?
Yeah, so what we call as a deep vein thrombosis, especially with knee replacements or any big lower limb surgeries, deep vein thrombosis is a cause for concern. So there are various ways where we tackle that. One is that you do have stockings, the sexy green stockings or white stockings, which you have to wear for a good amount of period of time based on the guidelines. So we follow the NICE guidelines for using DVT stockings, and also you get an anticoagulant. Anticoagulant can be an injection or a tablet. It really depends on various local policies, and also we really advise patients to drink and also mobilize.
Drink water.
Drink water. Yes, sorry. Drink water or tea, and mobilize. So mobilization, hydration, anticoagulants, and stockings are vital to prevent DVT and thrombus. And if there are any cause for concern in terms of your leg gets swollen or you feel difficulty in breathing, we would like you to seriously come to A&E as soon as possible.
What do you tell your favorite patient who's had a business class ticket booked 2 weeks after the operation to New York?
I would just say, can you transfer the business class ticket for me? Because I've never been in a business class. You might have, but I have never been. So I would just ask them to transfer the tickets to me. Yeah. The concept is that one should not allowed to fly long distances for 3 months. There are Department of Health guidelines and local guidelines to follow, which are quite important in terms of big surgeries like knee replacements, and especially people who are busy and do travels on a regular basis. This is one of the questions which should be clearly addressed before going into a surgery. What do you think? What do you tell patients about when can they go back to work? I mean, majority of patients ask those two questions: when can they drive, when can they go back to work, and when can they fly?
Assuming they have work before the procedure,
okay,
I would tell them they can go back to work, depending on the line of work. If it's a desk job, my ballpark figure, as for most orthopedic surgeons, is 6 weeks. It's a good number.
It's a favorite number.
1.5 months after any procedure or any fractures. So 6 weeks is a safe-ish number. By 2 weeks, they should be going down to the doctors, having their wounds checked, making sure it's clean and dry, and the sutures removed or the clips removed. But by and large, if they want to work from home, I would encourage them by 4 weeks to start working from home if it's an office-based job. And
what about manual work, or say if you're working, if you're climbing up and down the stairs?
Yeah, I mean, staircase climbing, I would prefer them starting as soon as possible. But manual work, I'd be seriously considering whether I should be doing a knee replacement in the first place, because that will entail an early retirement. But if it's just a desk job, office-based job, a job that involves a bit of travel here and there, 6 weeks I think is a useful sort of ballpark figure.
And what about sports?
Again, any sports that involves high impact loading and running, I would strongly discourage. I can't see any point in anyone jogging either for leisure or for fitness. There are other activities that can help in maintaining the caliber of fitness and cardiovascular status as opposed to jogging. But swimming, cycling, I would encourage again as soon as possible once the wounds have healed,
and golf?
Nice and dry. Depending on whether it's a flat plane or a hilly plane, flattish planes, I'd encourage them again by 6 weeks. A good
golf?
A good bit of fresh air wouldn't do the body much harm.
Okay.
So that's my kind of figure. But if it's a hilly course, around about 3 months.
But the twisting motions in golf, when you're hitting, probably for me, I would say 3 months.
I must say I don't play golf, so I don't know.
Okay.
What I can see.
Nor do I.